Want to pass your CCRN exam? Then let's get started. Today we'll cover 10 questions based on a renal system. Question 1. Which of the following laboratory findings is indicative of acute kidney injury? Increased urine output, decreased serum creatinine levels, elevated blood urea nitrogen, normal serum potassium levels. Pause the video and select your answer. If you chose option C, you are correct. Elevated blood urea nitrogen. Elevated blood urea nitrogen is a common laboratory finding in acute kidney injury due to impaired renal function and decreased glomerular filtration rate. Question 2. Which of the following medications is commonly used to treat hyperkalemia by promoting potassium excretion in the urine? Calcium gluconate, sodium bicarbonate, furosemide, Kxalate. Pause the video and select your answer. If you chose option C, you were correct. Furosemide. Furosemide, a loop diuretic, is commonly used to treat hyperkalemia by promoting potassium excretion in the urine through increased urinary flow rate. Question 3. Which of the following is a hallmark sign of nephrotic syndrome? Hematuria, hypoalbuminemia, hypertension, decreased urine output. Pause the video and select your answer. If you chose option B, you are correct. Hypoalbuminemia. Nephrotic syndrome is characterized by excess protein loss in the urine, leading to hypoalbuminemia, edemia, hyperlipidemia, and often hypercoagulability. Question 4. Which of the following is a complication associated with untreated or poorly controlled UTI in elderly patients? Nephrolithiasis, renal cell carcinoma, chronic kidney disease, polycystic kidney disease. Pause the video and select your answer. If you chose option C, you are correct. Chronic kidney disease. Untreated or poorly controlled UTIs in elderly patients can lead to chronic kidney disease due to recurrent renal infections and progressive renal damage. Question 5. Which of the following electrolyte imbalances is commonly associated with renal failure? Hypernatremia, hypercalcemia, hyperkalemia, hypophosphatemia. Pause the video and select your answer. If you chose option C, you are correct. Hyperkalemia. Hyperkalemia is a common electrolyte imbalance and renal failure due to impaired potassium excretion by the kidneys. Question 6. Which of the following is a primary function of the kidneys in maintaining acid-base balance? Regulation of blood pressure, production of erythropoietin, reabsorption of bicarbonate ions, secretion of aldosterone. Pause the video and select your answer. If you chose option C, you are correct. Reabsorption of bicarbonate ions. The kidneys play a crucial role in maintaining acid-base balance by reabsorbing bicarbonate ions and secreting hydrogen ions, helping to regulate blood pH within a normal range. Question 7. Which of the following is a characteristic feature of pre-renal acute kidney injury? Urine osmolality greater than 500, fractional excretion of sodium greater than 1%, elevated urine-specific gravity, bond to creatinine ratio less than 10 to 1. Pause the video and select your answer. If you chose option D, you are correct. Bond creatinine ratio 10 to 1. Pre-renal AKI is characterized by a decreased blood flow to the kidneys, leading to decreased glomerular filtration rate. This results in a disproportionate increase in blood urea nitrogen relative to serum creatinine. Hence, the bond creatinine ratio is typically 10 to 1. Question 8. Which of the following laboratory findings is consistent with acute tubular necrosis? Elevated urine sodium concentration, hypouricemia, increased urine pH, normal fractional excretion of sodium. Pause the video and select your answer. If you chose option A, you are correct. Elevated urine sodium concentration. Acute tubular necrosis is characterized by damage to the renal tubular epithelial cells, leading to impaired sodium reabsorption. This results in an elevated urine sodium concentration greater than 40 and an FeNA greater than 2%.